One of the first things that you have been seen on the field or documented is the unequal access to services, which actually is something that have been there and documented, whether it is subnational, whether it is by wealth or by other type of stratifiers like education or even areas. Looking at the rural areas, of course, that's the most obvious one. That's what we see. We also see that, of course, there are some areas that actually you could see on the map, some regions, some subnational areas that have not been going as fast as expected. And those have been actually highlighted in our research in what we do. That's actually the issue of inequality. And the second one, which is actually also something very important, is the staff shortage. And that has been critical because there's no way we could achieve equity or let me say even universal coverage without having enough health resources, human health resources. We need to maybe be doing more in not only better investing, but also in making sure that we retain those health workers because they are not staying there. They're not staying where they are, maybe the area, the conditions are not good for them, or maybe they are actually being recruited elsewhere. That's the other thing. And the last thing actually I want to also mention has to do with the lack of data. We are data people, we do research, and there's no way you could also implement program and action without data, without real data. And data have been lacking, particularly when it comes to mortality. Maternal mortality is really the very hard area, and we always deal with projection, with estimate, with data that are not really speaking to the countries.